I just finished my migraine appointment with my neurologist. It was a telehealth appointment. I accidentally showed up for it yesterday, which was embarrassing because I had to call and be like, hey, so nobody's showing up. And they're like, your appointment's tomorrow. So that's how my week started. Not gonna lie, I almost started crying when, I'm almost crying out when I was describing all the pain I go through every single month. And, yeah, like, when they ask, like, how many of those days, like, can you not get stuff done? And I'm like, most of them. So, yeah, that was a lot. It's really emotional because I've been having pain since I was 21 years old, and I'm 37 now. So that almost feels like half my life now. And it's not good. I can't get much done, and it's something I hate. I hate feeling this way, and I have no control over it. So I don't want to cry about this, but I'm also like about to start my period, and I'm super hormonal. So that's what's happening. So I actually was calculating my writing days for the next quarter yesterday, and I was like, automatically remove a week from every month. Like, I know there's going to be 1 week where I just will not get any writing done because I will be physically incapable of writing. And that's, I hate it because it stops me from getting so much work done. Like, it's impossible to work when your head hurts so much. You just can't do it. There's no way. I feel like, if you watch Taylor Wynn, she started talking about her migraines like a handful of years ago, and she started going through surgery. And it's so raw and honest, and it's like, she's one of the only YouTubers I've seen who like openly talks about how absolutely awful this is and how you can't get anything done in your life. And it's like, I'm so grateful to my job, because I honestly feel like if I worked in a different place, like, I would be on disability at this point. Like, I'd be broke. I would not be able to work. I like feel so much for anyone who has chronic debilitating conditions, like, no matter what they are. Like, you know who you are and you're out there, and you know it's impossible to live this way. So I got diagnosed with chronic migraines, no surprise. I'm gonna get a bunch of stuff, including a preventative, which may cause kidney stones. So like, it's one of those things where it's like, I know that the stuff you take for migraines comes with side effects. I know it. That's why I haven't succeeded at taking any of the stuff I've been prescribed before. But I also know I can't continue to live this way. I just can't. Like, it's getting to the point where I've tried every preventative method that I can afford. Because let's face it, there are some that I just can't afford. Would I love to try acupuncture? Sure. Can I have the budget for it? No. Like, so I'm sorry if this video sounds super gross sensitively because of my earpods, but I can't afford to go to a chiropractor. My insurance doesn't cover it. I can't afford to go to an acupuncturist. My insurance doesn't cover it. Those are alternative medicine treatments, and insurance just does not cover it. And my insurance is pretty decent. I'm on a state plan, but it just doesn't cover that kind of treatment. So I've tried all the other things, every at-home treatment I can try, vitamins, supplements, homeopathic. When I can afford a massage, I get one, but like, that is a luxury. That's not a thing I can afford on the regular. So we're gonna try this. It's a preventative medication that they build up every week, which will be interesting. I guess I have to go to my pharmacy every week now until it gets to a certain dosage. if the side effects are terrible, I'll just tell them, like, no, I can't do this, which is obviously the whole point. Like, I'll be seeing them again in 3 months. They're going to call me for a follow-up. So I'm going to receive a preventative, which is the one that can cause kidney stones, which is scary. So definitely have to watch my hydration. I also have to take it at night because it can cause some drowsiness, which is one of the problems with the other migraine medications I've taken. Like, they knock you out, and so they would make me non-functional, and then I would get rebound headaches. So I'd feel like, what was the point of that? Which is what I described to the doctor. They gave me a acute medication for when the migraine hits. That's supposed to have less of that type of a side effect, like less of a drowsy feeling, as well as naproxen to take with it for the muscle tension, I guess, and another medication that is supposed to help with nausea on the rare occasions when I do get like really bad nausea. It doesn't happen often, but it does happen sometimes, and I can usually treat it with ginger pills if it's pretty low level, but a couple of times nausea is what has ended me up in urgent care. So I'm just like trying to think, like, I don't want this to be for the rest of my life. I don't want to have to take another medication for the rest of my life, and I also know that, like, I don't want those side effects for the rest of my life, but if I could somehow get my migraine pain to be less, to regain some of my life and not, like, feel like I can't do my day-to-day work because it's staring at a screen and my head hurts too much to look at anything, then this will all have been worth it. So we'll see. I hope that it works. I hope that it doesn't cause the potential side effects, and I hope I don't have to take it forever. I also may have maybe qualified to be part of a study, because they were like, oh my god, you track everything, you would be great in a study. So I may be I may be part of an Eli Lilly study. Apparently they're going to try to see if I qualify, so that would be interesting. I don't 100% know that I would want to. Like, I'll obviously get all the insight into what that really involves, like what are they testing anyhow. But yeah, they were like, oh, you already use all the apps that we tell people to use, and you seem to, like, have your act together as far as, like, actually tracking things. Like, you seem to know a lot about your symptoms. I'm like, yeah, obsessive tracker here. I track everything. I like graphs. So that'll be interesting. So I'm gonna get back to work. The actual appointment took an hour and like 10 minutes. There were a lot of questions. Yeah, and hearing them, like, read back my history was just, like, kind of emotional for me. So that's what almost triggered the tears that didn't happen during the appointment, but obviously happened now, because, like I said, I'm also, like, low-key hormonal. So it's gonna be a fun day, guys. So I'll try to get some work done now. I did a thing. I feel like I don't know, like an anti-science crazy, but I'm not. Just putting it out there. Self-reflection is always important, but I was looking at the side effects for one of the medications and the preventative medication, and looking up other people's experiences with this medication. And honestly, I know that doctors obviously send you stuff where the risk outweighs, where the benefit outweighs the risk, but the risk is just too high. I can't risk the things that are in that list. And a lot of people say they do experience the side effects. So it was Topamax, topiramate, and it's apparently a very commonly prescribed anti-seizure drug that is used. And I know that anti-seizure drugs get used all the time. Now, the only symptoms that they told me about were that it could cause tingling in my hands, which is not great, and kidney stones, which was a concern because my mother and my father both have a risk of kidney stones. So that is a concern that I already had. What they didn't mention is among the risk factors is that you can't just stop taking this medication if you don't feel great on it, because it can cause seizures. You have to like wean off of it over time. And apparently also like extreme hair loss, anorexia, nausea, not wanting to eat anything because it tastes terrible are some of the other side effects. Now, jokingly, hello diet culture, the doctor's fellow, because it's a medical hospital with a school attached to it, was like, yeah, people usually love that they lose weight on this medication. So like, red flag. I wrote to the doctor and I was like, look, I respect you, I respect your decision. I would rather try the acute drug, which is what you take when you actually have a migraine, and see if the one that they prescribed actually works for me as opposed to the other two that I've tried in the past. Because if an acute drug doesn't make you feel great, you can just stop taking it because you're not supposed to take them regularly. This one is a medication that is not necessarily habit forming, but like you can't just come off of it. It needs to be weaned off of. And the other symptom that I really didn't like, and which many people report, is that it causes basically cognitive impairment. It causes brain fog, it causes the inability to like form sentences, and a lot of people report this, and I'm like, I already have enough of that when I do get a migraine. I don't want to walk around living my life not being able to communicate, which is what my job is. So I was like, I know that when you go to a doctor, you know, you're going to get prescribed stuff. I wish that there were alternatives that would be, you know, tried first before jumping to, you know, the hardcore drugs. But yeah, I'm like, I don't know. I don't know. I don't feel that this preventative treatment is one that I'm willing to risk. Glaucoma is another possible side effect. And of the top three that concern me, kidney stones, glaucoma, cognitive impairment, my family has a history of it. I don't want to risk turning into my parents, not when I've done so much to not get there. So, yeah, that's one of those things. It's like, I hate to come off as, excuse me, one of those patients that's like, oh, I'm wasting your time because you're going to prescribe stuff to me and I'm not going to take it. I'm not that patient. I do take my stuff. But also, if these side effects include so many things that my parents have, my grandparents have, like my grandmother has dementia, my grandfather had glaucoma, my grandmother had glaucoma, my mom had a little bit of glaucoma and had to have surgery for it. My dad and my mom both have kidney stones. Like I have too many factors already on both sides. I don't know. It's a nope for me. So I wrote to the doctor. I hope that she takes it well and it's just like, yeah, another person who doesn't want to do what I tell them, but I wasn't ready for that. I'm not gonna take that risk. I feel like though my migraines are debilitating, they have actually improved in the last few months with some of the preventative measures and supplements I've been taking, and maybe I can ride this out a little longer. As long as I can take something that stops it. That's my big thing. Like, I'm not necessarily looking for something that keeps them from coming. I just want something that when it happens, it ends it. Like, it stops it in its tracks. That's what I want. Because if I can end it, then it goes away. The problem is that none of the things I take really end it. I just have to ride it through to the end. They just kind of lessen it. So if I can find something that ends it, that's my goal. That is what I want. Tell me I'm doing the right thing. Like, give me some backup here, guys. I'm back in the office. I am alone, but I always get paranoid about talking too loud. I will be wearing a KN95 following this week because it's about to get busy here again with everybody returning from vacation, and I'm anxious about that. So we had a big town hall yesterday where they basically told us we expect at least a third to 50% of you to be out sick in the next few weeks. So gonna try to minimize those chances. I got some teas that my coworker brought us. It was like it might even be an advent calendar because it was a lot of teas. It looked like at least 25 in there. So we all kind of grabbed a few. These are Vadam teas. They're very good. That will look backwards to you guys, I think. But it's Earl Grey masala chai, Imperial Himalayan white tea, and Sweet Himalayan detox, which I have had before and is very nice. So I grabbed it again. So I have some nice little treats to enjoy. Gonna get some work done, get some stuff done. I'm a little bit more centered, I feel, since the other day. You can see my charger poking up. There we go. I don't feel great about the doctor I picked, to be honest. After the fact, when they called me back about making an appointment for a follow-up, but also about being a part of a study, and the study was using the medication that I don't feel comfortable with. And part of me is just like, did I get diagnosed so quickly and given this medication because they wanted a study participant? Like, is that why this particular one was picked out of all the others? Especially after I said that I do have a family history of kidney stones, and the main and most common, highly common side effect is basically like chronic kidney stones. I wrote back to the doctor, I think I mentioned earlier, and told her my hesitations, particularly with 3 symptoms being kidney stones, glaucoma, which is a rare but very serious side effect of this drug, and cognitive decline. All the stuff I've looked up, all the like reviews, and I've looked up videos, I've looked up blogs, I've looked up different medication review sites, a couple of the migraine apps like Chat, and even like some Reddit posts. It's common. Like the cognitive decline is one of the like things that a lot of people report back. That, like hair falling out, like inability to find words, memory loss, not remembering what you're doing, short-term memory loss, slurring your speech. And it's like, well, I have Alzheimer's in my family. I don't want to take that risk. And the fact that you can't just stop taking this medication, you have to be weaned off of it. It's basically a lifetime medication because it doesn't necessarily get rid of your migraines. It just supposedly prevents them by basically working in the brain to stop like the stuff that triggers seizures. I don't want to be on another lifetime medication for something that will not cure the root cause or even like address the root cause. It's more of a palliative than a real treatment in that sense, a cure I mean. And I don't want to take something that if I feel like trash, I can't just stop taking it because I can cause a seizure. Like, what? Like, I don't want to be worse than I am now. So all this to say that I told them, no thank you. I already told the doctor I didn't want to take this medication. I'm not going to be participating in your study. I feel like I wasted my time. I haven't picked up the meds yet. I've only received notification that one of them is ready, but I haven't even picked that up. They basically prescribed me a triptan, naproxen, and an anti-nausea, which I've been prescribed before, a different triptan, so we'll see if this one works. But most people with migraines will tell you they don't work great and they don't really fix anything. So I feel like I wasted 7 months waiting for an appointment that feels fruitless. I don't know. I might have to find a different neurologist, maybe not at a research facility, because it's like, are you just looking for people to be part of your research study? The problem is that most of the neurologists in the area, because it's South Florida, are geriatric. So they're not concerned with migraines, they're concerned with Alzheimer's, Parkinson's, that kind of stuff, which is great. Like, I too would like to, go to a neurologist for those reasons because of my family history. But I need somebody who is good at reading and dealing with migraines. So we'll see. I don't know. Part of me feels like I need to go back to the drawing board and try to find a functional medicine practitioner. That's also another thing that's kind of hard to find for me down here in South Florida. Too many are like the kinds of people who'll just be like, let's green juice all day and call it a cure. That's not what I'm looking for. So we're back to square one. I'm gonna settle in for work, and I'll be working from home for the rest of the week. I got selected for random COVID testing, so it's a good thing that I had already pre-scheduled for this week, assuming that it would be a good practice to get tested. So that's that. That will be tomorrow. Today, just gonna have a normal day in my office.